Well, again, good morning and welcome to the morning briefing presented by the Washington County Chamber of Commerce. I'm Jeff Catula, president of the Chamber. And this morning, we'd like to thank our sponsors for being with us and helping to support this great event. It's Range Resources, Community Bank, Pennsylvania American Water, West Penn Power, and Moody and Associates. We certainly appreciate their continued support as well as their efforts to bring you this important programming. The intent of our morning briefing is to really update you on the COVID-19 emergency, as well as provide access to our members and business community on those people that are leading the efforts to keep our community safe. And this morning, we're very pleased to welcome Brook Ward, President and CEO of the Washington Health System, and Louis J. Panza Jr., President and CEO of the Monongahela Valley Hospital. Gentlemen, good morning, and thank you for being with us.
Good morning.
I can only imagine what you guys are going through right now at the hospital. So let me begin by just thanking you and your teams at the hospital for your tremendous work in keeping Washington County safe. And I hope you'll pass along that to all of your team members and everyone working right now there. We certainly appreciate it. We'd like to start by asking really an update on what the current situation is at both hospitals. And we'll start off with Brook. Brook, if you wouldn't mind providing our members with an update of what's going on currently.
Absolutely. Thank you, Jeff. Also want to thank you for having Lou and I today on with the program. Appreciate that. And Lou, it's an honor being on the panel with you. What's going on really in our community at this point is we're doing a number of things. First and foremost, we're following the governor's orders to sort of shut down all elective, non-urgent, services and cases that can be, slowed down to help fight the curve and lower the curve of the people who are getting infected. In addition to that, we're dealing right now with the plan for the surge. And probably like Lou, we're monitoring projections and a number of different models about when that rate of infection will go up, when we might see the surge hitting our organization and our community. And I've been telling our board, it's a little bit like watching the National Weather Service with the hurricane predictions. There's 12 different models. The path could go 12 different ways. There's a worst case and a best case. And at this point, I'm just hoping for a lot of rain in Fort Lauderdale or something, but not a direct hit on Miami. In addition to that, while we're fighting and getting ready for the surge, we're also, downsizing employees in other parts of the organization, because where we have services closed off, we have expenses that continue. And so on one hand, we're fighting the need to try and ramp up and be ready, cross-train people who haven't worked in an ICU or an inpatient floor in ED for a while to get ready for the surge, while at the same time dealing with the financial distress of seeing over half of our revenue essentially cut off. And so we've been dealing with that as we go forward. And then from my perspective, and I'm sure Lou would say the same thing, we're trying to communicate like crazy in every venue we can, including this one, to get the word out. Part of that is to keep people informed, tell people what the plan is, and make sure that they understand where we're going. Another part of that is just trying to keep people calm and fight panic and fear. And then lastly, just yesterday afternoon, Lou and I and others received an order from the governor, an executive order that we have a number of days here, 5 days, do a complete inventory of all our personal protective equipment, ventilators, medications, and other supplies, and submit that to the state. And then this executive order would give them the right to commandeer and take that from our organizations to give it where they think the greatest need is. And so this just came down yesterday. I know we're going to be looking at that, trying to determine what the impact is. And I'm hoping they're not going to rip product out of our building that we need to protect our employees and our team members. So those are some of the immediate things we've been dealing with, not only today and yesterday, but the last week or so. And at this point, I'll let Lou respond and add to that.
Thanks, Brooke. And again, Jeff, thanks to you and the Chamber and Brooke for being part of this today. We appreciate that. Very similar to Washington Hospital, we've done the same things as far as eliminating all elective surgeries and procedures at the hospital. That's for two reasons. One, to help slow the spread, and secondly, to salvage the personal protective equipment that we have. You use a lot of that when you do elective surgeries. And so again, by not doing those, we've been able to hold our stockpiles a little higher. Similar to other hospitals, we have our drive-through capability set up for people who are in need of testing for COVID-19, so they don't have to come into the building. We can swab them right in their cars and send them out for testing. From that same standpoint, I, like Brooke, did get the same governor order last night about doing our inventories. We are already reporting out on a regular basis. So for 8 a.m., 4 p.m., and it used to be a midnight one. They got rid of the midnight ones where we have to provide the state our bed counts, our ICU counts, our ventilator use counts. Now they're looking at PPE. I'm hoping that they're also looking at the PPE suppliers and what's in their warehouses to see where their products may be still stored. And that would be the supplies that they come out after. Again, like Brook, we're both looking at projections. I like your hurricane thought, Brook. I've been kind of talking about it being more like a tsunami. The water kind of pulls away from the shore, and it's pulled away with the stopping of visitors, the stopping of elective procedures, and now you're just waiting to see how big a wave is going to come back and when it comes back. And you're right, it is. You're just sitting there waiting for it to come, and you just don't know when. We keep hearing projections that it's going to come, sooner and sooner and sooner, but at this point, Washington County's been pretty lucky. We've not had the number of issues of a Detroit or a New York City or a Washington State. So again, I think the people of Washington County have practiced pretty good social distancing and been very careful.
What do you, as you know, the situation is very fluid day to day, week to week. Is there any way you could give us kind of your thoughts on what the next week holds for you?
Sure, I'll start.
Go ahead, Brook. No, go Brook, please.
I think first and foremost, like we just mentioned, we need to respond to the new executive order by the governor. We'll be dealing with that the next couple of days and trying to figure out what the fallout is if that's going to be. Are we going to lose product and PPE that's sitting on our shelves? Are they going to divert supplies that are scheduled to be delivered to us, those kind of things? Secondarily, as Lou said, depending on the model you look at, the projections, some of them are saying the surge would happen in this area starting anywhere from this weekend up through the next week or two. And there are other models projecting it won't happen until the end of April, going into early May. And so we are going to continue to monitor that every single day. We do have surge plans in place that we could enact at any moment to take our current ICU from 27 beds up to 51. We normally would have 14 ventilators. We have the capability of having 49 people on ventilators at this point. And if we needed to expand our ICU beyond that, we would go down to our pre-op, our post-op area, and we could have ICU in that area. Expansion plans for normal inpatient beds, and of course, we have the capability of almost doubling our ED size if we need it. And so we'll be monitoring the situation as it comes and adjusting to that on the fly. On the opposite side of this, as I said earlier, as we plan for the surge, we also have to plan for the economic distress that the services that are shut off. And so we're going to continue to monitor those departments. We'll be making decisions week by week as to whether or not we continue to have employees, in some cases laid off or reduced hours, and then adjust those. And then if we have a surge, we may need to bring some of those folks back, probably not in a clinical role. They may not have that skill set, but here's extra helping hands. And so it's really about sort of, again, communicating, keeping an eye on it, and being prepared for Lou's tsunami.
Yeah, I agree. And that's really what all hospitals are doing. We're as they say, you hope, prepare for the worst and hope for the best. And that's what Mon Valley's doing, like every hospital. The other thing that we've been working on too, and I'm sure Brook's done the same, is just like you, we actually have a lot of our people now working from home where possible. And that does two things. One, it provides us, more social distancing. And secondly, if there is an issue with the staff here, because remember, they're at high risk. I think that the community has been absolutely wonderful recognizing the risks that our employees take each and every day when you're dealing with a pandemic like this and working with these types of patients. That should some of them get sick, having some of our people at home that can actually be the second team coming in behind them is important also. So we've been working on trying to watch those staffing patterns as well to make sure we can maintain enough employees should there become a horrible surge.
I know both of your hospitals have implemented no visitor policies. What are you doing to keep families informed for those that are hospitalized during this time?
Well, first of all, I think our staff, when you decide to be a hospital employee, not just a healthcare worker, but a hospital person, the 24/7 schedules, the 365s, you're working the holidays, there's something special about these people who do that. So they're making the phone calls to family members a lot more, keeping them up to date as to what's going on. Obviously, a hospital of our size and Brooks Hospital, we all have free Wi-Fi out there. So we have a lot of family members now that have their iPads with them. They have their smartphones with them. They're able to FaceTime. There are some families who are doing Zoom family meetings where everybody gets together and talk. So we're seeing a lot of that virtual connection going on with our families, and so that actually has been working quite well for them. And if they don't have that capability, we have some resources that we can loan them so the family can have those conversations.
Yeah, and the only thing I would add to that, we're doing all those things as well, is we're scheduling a daily call with our clinical team and the family members, where our clinical team can get on the phone and communicate to their loved ones what's going on with their health, because they can't be there in person to listen to the physician and the nurse communicate with the patient in the bed. So we continue to do that. And Lou's probably doing these things as well. We're trying to celebrate the small things. So for example, we had an 86-year-old in here who had a birthday the other day. Of course, the family couldn't come in. So we did a virtual birthday party using FaceTime. The family delivered cards. And so the nursing staff in the room using FaceTime could read the cards, post them on the wall, let their grandfather, communicate with them. And it's those small things that I think help in a situation like this.
And that's
Absolutely.
Nice. That's nice.
Yeah, absolutely.
It is important for families to be together.
Absolutely, Jeff. And Brooke's right. We're all doing whatever we can. At this time, I think the way I would phrase it is our staff knows that they've become the family.
Mm-hmm.
And that's how they see their responsibilities and their role. And they've taken it on with great pride.
Now, there's been a lot of questions about cloth masks. What do you make them out of? Things of that nature. Do you guys have any advice for those out there that are interested in making them at home or in trying to follow the governor's orders to wear them as much as possible?
That probably has been one of the most popular questions of the last 4 or 5 days about cloth masks. I'm going to be perfectly honest. Remember, I'm coming out of the administrative side, so I've asked our public relations team to put up on our Facebook account masks for dummies, basically, because a lot of people don't know how to wear a mask. They wear them under their nose, not over their nose. I've seen them on upside down. I've seen them on inside out. So we're trying to help people because you really do get trained how to use this stuff. Just something as simple as making sure you touch it by the loops behind your ear. You don't touch the front of the mask because that would actually end up touching your fingers, and then you touch your face, and you've kind of lost all the protection you were hoping for. The second thing is washing them. If you do get a cloth mask, there are lots of patterns. I mean, in the day of Google, you can get a mask pattern in a heartbeat. So if you know somebody who can sew, there's a lot of internet resources out there about how to make one. But you do need to wash it in hot, soapy water, just like your hands. The 20 seconds, soap and water. Your mask needs to be washed in hot, soapy water and get dried. Hopefully, if you can get 1 or 2, then you can alternate and wash one every night. But you really do need to wash it. And then the second thing is, wearing a mask is not a substitute for social distancing. That's the other thing people believe, that, oh, now I have a mask, we can all be near each other. Cloth masks, as the governor noted, is not the quality we use in a hospital. But considering that there's such a shortage of hospital grade equipment, I appreciate the governor suggested you don't try to use the hospital grade equipment we need in using cloth. They provide a lot of protection. They're not perfect, but they're not a substitute for social distancing. I don't know about Brooke.
I think you summed it up well, Lou. The only thing I would add is, I'd highly encourage everybody in our community, when they leave their home, to put a mask on. And really, it's not only so that they can be protected, it's so that they're protecting others that they're around. That whole philosophy we're hearing out of Eastern Europe around, I'm wearing the mask to protect you and you're wearing it to protect me. And I think that's the message we need to get out across our community.
Absolutely.
Before we go on to our next question, I would like to remind our participants this morning on the webinar that they're free to ask questions at the Q&A button at the bottom of the screen, and we'll try to get to as many as possible during this conversation. And the final question I have before we start some Q&A from our audience is, Washington County is a very generous county. Our people are very giving, and we're very proud of that here in our county. I'm sure local businesses, local individuals have reached out to you to provide you with free lunches and PPE and things of that nature. What do you recommend for them to do? What do you need from us in Washington County to keep your employees safe and to help you do your jobs? And we could start with Brooke.
I would start by saying, first off, thank you to everybody in the community who's donated anything, whether it's monetary, PPE, or food. I mean, thank you. We really appreciate it. It means a lot to our team. You'd be surprised at how special the clinical team feels right now by the outpouring of support. I think the number one thing everybody can do through our employers and businesses is remind people of the things we've already been talking about today: social distancing, washing your hands, wearing a mask when in public. Promoting that concept, trying to get that out through the entire community is, I think, important, and that will help keep our team safe. That'll help flatten the curve and prevent us being overrun with people who are sick. If they feel so inclined and want to support the organizations, both Lou and mine and other healthcare organizations, of course, monetary donations are great, and we've had hundreds of people and businesses at this point send in cash, donate online, those kind of things, and we're truly appreciative of that. All of that money is going towards supplies for fighting COVID-19. Secondarily, we had businesses and individuals donate PPE, and we've been taking all that, everything from N95 masks, respirators, masks, goggles, including cloth masks. We've had over 1,000 of these donated to the organization that we've deployed to our team members. As you see, I have mine with me as we speak. And then finally, food. As Jeff mentioned, that seems to be, I don't want to say the number one thing people want to do, but a lot of people have been very adamant about supplying food to the, as they say, sort of the folks on the front lines. And admittedly, that's been a challenge for us because, I don't think people realize we have 2,000 employees at over 30 locations, and then some of those are 24/7 operations. So, 30 pizzas being dropped off at the ED door may help serve and provide lunch to one department. But it's not easy to deliver food around the clock to all these locations. And so we're working with businesses and individuals who want to do that. We're appreciative, but it is a logistical issue in a time when we have essentially a crisis.
I agree with everything Brooke said. Thank you, thank you, thank you. The community outpouring has been wonderful, whether it's the PPE donations, some big, some small. There's nothing that we won't accept. We really appreciate it. Somebody said, all I have is like, a couple boxes of N95s. Well, a couple boxes means a couple more days of protecting, some employees. And so we truly appreciate that. The cash helps a lot, especially because I'm sure you've heard the stories. 60-cent masks that we used to buy 3 weeks ago are now $4 masks this week. So the cost of even us buying it when we can find it out in the market has gone up dramatically. I know that both the governor and on the federal side, they're watching for those things, but that's been an issue. I also thank the retailers. A lot of retailers have been very, very generous to healthcare workers, whether it means letting our people in the store at the front of the line sometimes, opening up early for them because they do work a lot of crazy shifts. So as some of the retailers have shortened up their hours, again, that kind of simple generosity. And I'll tell you a funny story. I drove onto campus today and somebody had placed a sign on our main driveway today saying, thank you to the doctors and nurses for taking care of us. I don't know who put the sign there, but overnight somebody left a sign on our main driveway coming up the road today. And that's just the kind of people Washington County are.
That's well said, Lucas. I agree. We've been getting even questions here at the Chamber, how can we help? How can we donate? And I think it might be important too for both of you just to let our viewers know, who is the person that they could contact at your organizations if they want to make a donation or provide some products, things of that nature.
Yeah, at the Washington Health System, the best person to contact would be the Washington Health System Foundation. And Sarah Schumacher is the executive director of that organization for us. She'd be the point of contact on our end.
And the same thing, just like Brooke, as he noted, the coordination at the hospital right now is about caregiving. So we're using the Monongahela Valley Hospital Foundation likewise. So Mark Spitzer, our executive director, Melissa Marion, our assistant director over there, either one of those. So go through our foundations is the best place to go.
And we'll put that information out on our constant contact and social media as well when this is over.
Thank you.
We have some questions coming in. The first question is, Washington County seems to be pretty good at avoiding COVID-19. We have a relatively low number of cases in comparison to our neighboring counties. What do you think is contributing to that?
Well, I would hope it's the fact that we're doing a good job with social distancing, hand hygiene, wearing masks, those kind of things. Because it's not for lack of testing. Between Lou and his organization, the Washington Health System, we've had dedicated pop-up testing sites long before almost every community, including Pittsburgh. So we've been testing people going back to, I think, March 12th. And so it's not for lack of testing. So I hope it's all those things that people are doing right. And I don't know if Lou feels any different, but that's a tough question and a hard one to answer, but that's my take on it.
I would echo what Brooke said, and I would leave out the Centerville clinics. They've had their testing setups too. So all the healthcare providers in Washington County have worked together to make sure we have as many capabilities as possible. Part of the issue on testing still is it's still there's how much testing capabilities are available out there. We can take samples, but being able to get the labs to process enough, having enough reagents to run the test is still an issue a bit, but that's nationwide. The other thing I would think though, Jeff, some of the places, the hotspots, have been density of population. New York City, for instance, when you have that many people per square mile, the contact and the social distancing is a little tougher. I think that Washington, we service parts of Westmoreland, Fayette, as does Washington Hospital, Greene County. We get a little bit of natural social distancing just because of the layout of our homes. I also think that people are very good. I go to grocery stores when I have to, just like everybody else, and I actually see people keeping that 5-foot distance at the deli counter, keeping that 5-foot distance at the checkout counters. I think that makes a difference and goes a long way to helping people. Again, there's a general good, healthy respect in this area, and I think that's making a difference.
There's been numerous questions we've seen on here concerning ventilators and the numbers that each one of your hospitals have. Would you care to elaborate on that in terms of numbers and how that would tie into, say, a major surge that may happen, that we hopefully doesn't happen, but may?
Yeah, as I said earlier, normally and before this, we had 14 ventilators in our ICU that we could use for patients, and it would be extremely rare that we would have gotten to 14. We might have 6, 8, 10 on a ventilator at any given time, and we always had a little bit extra. But planning for the surge, we know that there's going to be a certain percentage of people who get sick who need to be hospitalized, and of those, a smaller percentage are going to need an ICU bed, and a ventilator is going to be critical. And there's some early evidence that early intubation in using a ventilator is an important factor for with people to recover. And so at this point, as it stands today, we have the capability of having 49 people on a ventilator in our ICU if we need it. And then of course, there are plans on the internet where you can take a ventilator and put multiple patients, 2, 3, 4 on one ventilator. That would be extreme. That would be last resort. But right now, as it stands, we could do 49 without getting to that point.
At Mon Valley, one of the things you need to also is just not the ventilators. We're about half the numbers. We normally would run around 8 as our normal load of using about 4 with 4 in reserve. We can get up to 22 right now. But the other thing we needed to do was negative pressure rooms, because again, if you do have somebody with a contagious virus, you have to be able to vent the air in that room outside so it doesn't go through your whole hospital. And back to the generosity, we had a couple contractors who had great big HEPA filter machines. We've actually placed those, and we were able to increase from 1 to 8 critical care rooms to negative pressure rooms through loaned equipment from some of our contractors in the area. So we were able to actually convert the hospital from positive rooms to negative rooms through donations. And we've done that both on our critical care floor, and we've done it on one wing of the hospital where we're consolidating some of the suspect COVID patients.
Yeah, that's a great point, Lou. We've done a similar thing here, and we took the 14 negative pressure rooms we had, supplemented them with those devices. And so at this point, we added another almost 30 negative pressure rooms due to those machines from the contractors.
A question we have, and I think is actually a good one, is what is the biggest challenge both of you are having right now with respect to the virus?
Well, I
I'm,
don't
I'm,
know.
go
Go
ahead.
ahead, Lou.
I was going to say, I think Brooks' comment at the beginning is probably one of the biggest challenges. Is the fact that we're sitting here waiting for a surge that we hope never comes, while seeing no patients. So the financial drains on our institutions is massive. You're training staff, you're teaching staff, you're buying supplies at a premium cost, and quite frankly, community hospitals like Mon Valley, we live on elective surgeries. That's what we do. You have that elective orthopedic case, the elective urology case, and those are all being postponed right now. So you're trying to run a hospital with 150 beds with 70 patients in it, and so it's a little tricky right now from a financial challenge. The other thing I would say is, you also have a staff who, every day is waiting just like we are for the surge, and it doesn't come today and it doesn't come tomorrow. And I've talked about the tsunami. It's also sort of like waiting for the air raid to hit. And so there's a nervousness in the staff that I think both Brooke and I spend a good part of our day working with our team, just trying to keep them understanding that they are prepared. They are the best of the best. These are well-trained people that work in hospitals, and they spend their day prepping for what they hope never comes. But there's a certain intensity. So here at Mon Valley, I'm sure Brooke's done the same thing. Tuesday was what we called Fun Day. We just let anybody wear anything they want, from their luau shirts to their blue jeans, just to give the staff a day to take a deep breath and relax a little bit. And so we'll be doing more of those things. But I think trying to keep the staff, all together has been one of the challenges.
Yeah, the only thing I would add to that is, Lou summed it up well. I think we're fighting a lot of misinformation, a lot of rumors, a lot of fake, information. So, for example, there was some rumor running around part of our building last week that we had the morgue full of dead bodies who were positive corona, which wasn't true. Matter of fact, I asked for a count of what was down there, and at the time, I think we had 3 bodies who were waiting to go home. One of those was a suspect patient who we found out within an hour was negative, but somehow that turned into a morgue full of bodies, and that we were, not being truthful about. And so it's those little things you have to sort of squash all the time to try and keep people calm. And, and as Lou said, they're on edge. I mean, they're great people. They've trained for this kind of thing their whole life. They're dedicated. That doesn't mean they're not worried about their own personal safety and the safety of their family. And so the misinformation and dealing with that has been a struggle, and something we deal with every day.
Jeff, if I could also add, for everybody online, you need to realize our hospitals trained on a regular basis for mass casualties. We train for pandemics, but this is a virus. So is the flu A, the flu B, TB, MRSA, MERS, SARS, C. diff. Our staff deals with issues of contagious viruses, contagious diseases on a regular basis. It's the scaling of this particular issue that is what we're working on. But the staff knows how to do this, and that's why we actually have personal protective equipment in our hospital. So again, I think that's one of the things that the community needs to be aware of, is what we're talking about is scaling up to what we already know how to do. We do this every single day in our hospitals.
I will say too, we have a lot of comments coming in asking me to thank you, gentlemen, and your teams for the great work you're doing. I'd also like, and I know Lou, you mentioned the Centerville Clinics and Canonsburg Hospital. They're doing a lot of great things for our community now as well. And I'd like to thank them and their teams as well. But we do have time for one more question. And this concerns the Easter holiday coming up over the weekend. Everybody wants to be with their families. This is going to be a tough time, especially for grandparents wanting to see their grandchildren, families wanting to be together. What's the best advice you can offer right now in terms of the upcoming holiday? Maybe not even just concerns washing your hands and social distancing, but really, what's the best advice you can offer?
Do you want to go ahead?
Yeah, I hate to say this, as a person who loves family and wants to be with them, I've already made it clear to my mom. We'll be calling her and FaceTiming with her on Easter, but Easter dinner's off this year. We see it in healthcare on a regular basis, After Thanksgiving, about 3-4 days later, we get a flu spike. After Christmas, we get a flu spike. Why? Because people get together for family dinners, they hug, they kiss. It's part of what we do. And so what I have to suggest is that this year for Easter, make the big dinner. Drop it off at grandma's house. Don't have grandma to the house, because we'd really prefer not to see an Easter dinner COVID spike 4 or 5 days after Easter this year.
Yeah. Brooke?
I think Lou summed it up great. I think we can't have the normal traditions we have. Do the best you can with technology. And as Lou said, drop off the meal to grandma, but don't go in the house with her. Just put it on the front porch, let her take it in, and wish her well. And that's the best thing you do to keep her safe and you safe.
Thank you very much. And again, please pass along our thanks to your teams at the hospital for the great work that they're doing. And gentlemen, thank you for being with us this morning as well. Brook Ward, President and CEO of the Washington Health System. Lou Panza, President and CEO of Monongahela Valley. Thank you for your time this morning. We certainly appreciate you answering our questions and informing our community of the things you're doing right now to protect us. We certainly appreciate that. Thank you very much.
Thanks for having
Thank
us.
you, Jeff.
Again, our sponsors, Range Resources, Community Bank, Pennsylvania American Water, West Penn Power, and Moody Associates for their continued support. Next week, we're going to be hosting Jeff Yates, who is the Director of Washington County's Department of Public Safety. He'll be on with us next Thursday, April 16th at 7:30. So we appreciate you tuning in with us this morning and being with us. Be safe and have a wonderful Easter and Passover. Thank you.